Good morning. Welcome to the second of three webinars directed towards looking at the current COVID crisis and the effect on the direct force workforce of our community here. My name is Dr. William Leahy, and I am chairman of the board of the Maryland Regional Direct Services Collaborative. Our collaborative was founded almost 3 years ago. The focus of the collaborative was to look at three particular areas, particularly focused upon our direct services group. Number one, to look at workforce development and supply. Secondly, to look at training and education. And thirdly, to look at the area of wages and benefit for this profession. 6 months ago, all of us were catapulted into a new world with the development of the COVID crisis. As you all know, this has had tremendous implications on our workers in this critical area, and has forced us to begin to think a little bit of new ways in which to look at the three focuses that we established 3 years ago. The webinar are all going to be involved in helping us to look at the experience with COVID. The first of the webinars was on the 10th of September, and at that point we had a panel which was focused of several of the individuals from the direct workforce and their experience with COVID. Today we're going to take a look at action steps that were taken during the pandemic by providers, employers, and public agencies to support the frontline direct service workers. And if you can, on October the 22nd, Thursday, we will have the third of the three webinars. This will be focused on transforming the direct services workforce, what we have learned through the COVID experience and ways in which to modify or to assist this very critical workforce supply. We'd like to thank the Rodham Institute, and in particular, Christina Williams, who has been so diligent in putting together the advertising and the implementation of today's webinar and the one previously and the one on October 22nd. Thank you again to the Rodham Institute and George Washington University. We have today three distinctive individuals who have had tremendous experience in workforce development, each of whom will be involved with setting the stage for us, and then we will have the panel presentation with another four group of seriously experienced individuals, and then we'll wind up in about an hour and a half or so with a further discussion. Joe DeMattos, who is the CEO and president of the Health Facilities of Maryland, is going to kick us off today. The topic is going to be COVID-19, the toolkit needed to cope with issues confronted by the frontline workforce. Joe has been involved with the healthcare facility for a number of years. And Joe, we're going to turn it over to you to give us the keynote presentation.
Dr. Leahy, thank you so much for that kind introduction. It's so great to see familiar faces here on this Zoom. And I really want to thank you, Dr. Leahy, for your leadership, Ron Carlson for his leadership, the Rodham Foundation, of course, George Washington University. I want to begin first, if I can get the technology to work, to show a short video. And let me get that going. It'll take like a minute. I'm on it. Okay. And we're going to go like that in a moment. And there we go. And we're going to put share computer audio on. Oh, interesting. It will now not let me share. If somebody could give me host privileges, I'd really like to share this video. We'll give it a minute, see if we can make it happen. Whoever's running the back of the Zoom. And if we can't, we'll move on. It's only been a couple of minutes. All right, I'm going to try it again. There we go. I think we've got it. Please join me in watching this.
Not slowing down, a sharp rise in the number of new coronavirus cases in Maryland.
Everybody is fighting to save every life we can.
When's it going to end? That's what I'm really thinking.
A battle is being waged against an enemy we can't see.
The most susceptible people to the coronavirus have been the elderly, so nursing homes, assisted living facilities, senior centers.
We are very concerned about this virus.
In the midst of chaos, you choose to stand and fight. To protect. To selflessly serve. To those of you working in Maryland skilled nursing and rehabilitation centers and on assisted living campuses, you number in the tens of thousands here in Maryland. And we are so thankful for each and every one of you. You are all heroes. Our employees are proving themselves to be not just essential workers, but frontline healthcare warriors.
Period of years and not months. You know, the pandemic shined a bright light on healthcare disparities and social determinants of health. It also shone a bright light on the fact that we have a real flawed system to pay for care in this country. The lack of a national model to pay for long-term and post-acute care. Yeah, we pay for rehab care, but we don't spend enough money to keep people in their 40s and 50s from getting sick enough so that they need a high level of post-acute care or long-term care when they're older. So, and then when they need it, we have to rely on state Medicaid budgets, which were massively strained before the crisis and will be strained even more massively after. You know, a post-acute long-term care is the only sector where about 80% of the fees collected are non-negotiable through Medicare and Medicaid, but about 70% of the costs go to labor and benefits and are regulated in the form of staffing ratios and otherwise. So let's talk real quick for 2 minutes on the pandemic. Relative to today's discussion again, the pandemic really amplified the issues that the collaborative is focused on. Let me begin with the end and then start a wee bit in the beginning and go back to the end. Today we learned that the President and the First Lady are COVID positive. We will be fighting this virus actively until there is a broadly available vaccine. And that will be measured in probably years and not months. And this particular virus attacks people with pre-existing conditions and chronic conditions, who are the majority of folks in post-acute and long-term care. So our sector will be on the front lines and our heroes will be on the front lines for a long time to come. So where we are today is we are better than we were in March and April, but we can expect ups and downs going forward. March and April, we had major hot spots in pretty much every skilled nursing and rehab center in Maryland, double-digit cases. And we had a horrible realization in the end of March when we learned beyond a reasonable doubt that this virus can be transmitted and people can be carrying it that are asymptomatic, which meant that all of the traditional methods of droplets precautions and screening were a little bit more problematic, maybe way more problematic. So we got through together the horrible days of March and April, which were truly rugged, truly horrible, unimaginable really. And we got better in May. We got better still in June. And so in June, we had about 60 nursing homes that had single cases or less than 10 cases. Much better. Then we had the July 4th holiday. And 2 weeks after July 4th, we had 180 nursing homes with 1 or 2 cases. So you see that correlation between communities opening up more and how hot a community is versus how hot a nursing home and assisted living campus is in. And then we had most recently Labor Day, and Labor Day has been a lot more productive. We didn't have as big a spike as we did on the 4th of July. But you know, the takeaways from this are that all of the challenges of the collaborative relative to workforce, retention, recruitment, training, wages, and benefits, I would add the issues of diversity, inclusion, and equity. All of those issues are going to need all of our efforts, and the funding part of it is going to take all of our efforts going forward. And then let me just end with this. Let's remember the face. Let's remember the important stuff. Every death is to be mourned. Every life saved is to be celebrated. And our work is to do all we can within our control to save as many lives as possible. And while we focus on those who have left us because of this virus and mourn their loss, the truth also is that during this period here in Maryland, our frontline caregivers have provided millions of days of care to Marylanders in need. So I cannot thank you all enough at the Rodham Institute, at GW, Dr. Leahy, and I just want to give a special shout out to Ron Carlson, who is just a source of strength and inspiration to me, and I want the world to know it. So thank you all, and I look forward to the panelists.
Joe, thank you very much for putting together such a concise history of the last 6 months with a lot of prescient and critical bits of information. We're now going to turn to a panel of experts who have been put together, a group of individuals who have been working at various levels during this time of COVID, and hear about their experience and hear a little bit about how they've worked with their organizations to look at and to help to solve the various issues that Joe has discussed so eloquently. The moderator for the next hour and the panelists will be Jill Schumann. I've had the pleasure of meeting Jill when the collaborative first was put together 3 years ago. This is a terrifically experienced and compassionate individual who's had a world of wonderful experience, who brings to this panel discussion, I think, a good deal. Jill originally was the president and the CEO of the Lutheran Services of America, and in 2012 she launched Leading Age of Maryland and was the founding CEO, and recently, probably about 6 or 8 months ago, retired as the president and the CEO of Leading Age of Maryland. She has a wealth of experience in all of these areas and will serve as a terrific moderator. So Jill, I'm going to turn it over to you for the next hour.
Great, thanks. I'm Jill Schumann, And we're really looking forward to these panel presentations that will be dealing with interventions and initiatives underway in the region in this time of pandemic, as we said, and again, with a focus on direct service workers. Now, one of the things we want to do is make this interactive. So we'll first have all of the presentations, but while they're speaking, make sure that you're using the chat feature to type in comments and questions. And then when we get to the end of the panel presentations, we'll make this interactive and take those questions and comments and make sure that our audience is also engaged. First, we'll be hearing from Dawn Seek, who's the CEO of the Maryland National Capital Home Care Association. Dawn is a licensed practical nurse who also holds a degree in business management. She's a member of the National Association of Home Care Forum and serves as a board member of the DC Long-Term Care Coalition. Dawn, welcome. Over to you.
Thank you. I'm going to share my screen. There we go. Well, thank you very much for this opportunity today to share. I want to thank Ron and his team for putting this together. I also want to say that Minka and me personally are proud to be members of the collaborative. I want to start a little bit about who Minka is. We are the Maryland National Capital Home Care Association. We're a nonprofit trade association that represents home health, home care, and durable medical equipment providers in Maryland and DC. While we have 84 member companies, we represent the entire industry in Maryland and DC, and we represent thousands and thousands of direct home care workers. We do have a board of 12 volunteer members and me. Our mission is to provide legislative advocacy, education, and networking opportunities to our members and to others in the industry. Normally, we spend time in Annapolis educating the legislators and working on bills, always with concern for the best interest of our providers, our caregivers, and the patients that we serve. And as you know, this year will be quite different as everything will be held virtually. We provide educational opportunities throughout the year, as well as networking opportunities to bring our organizations together. As you can see here, we are represented on a lot of different groups, and this is to support the direct care workers, as well as, and then when I say that, the direct care workers include all of the CNAs, home health aides, nurses, physical therapists, occupational therapists, and other home care providers. So around March 1st, we began getting calls from providers that were desperate for information on the pandemic and helping to find PPE. Agencies were calling asking for help as their direct care workers had little to no PPE at all. My role quickly became the COVID crisis coordinator for Minka. I worked long days and weekends searching for information and supplies. During this time, I attended as many events as possible to gain knowledge and resources that were then put back out to the membership. As you can see, this was minimally 125 different events. So luckily, after many phone calls and lots of pleading with government officials, we secured 10 pallets of PPE from the Maryland stockpile. This was distributed to 22 of our member agencies. I gathered information through surveys to understand how best to support the industry, and I continued our search for PPE vendors. During that time, I contacted Maryland Department of Health Office of Preparedness and Response and asked them if they had additional grant money available so that we could do some COVID training for our direct care workers. I want to give a shout out to our reliable and reputable PPE vendors. We were able to build relationships with these two companies. Crooked Monkey doesn't sound like a PPE provider, and they weren't. They were actually a t-shirt company that converted to being a PPE provider. And the American Advertising Specialties is supporting Minka as they are giving back to Minka for any of the orders that are placed on this website. So we're very grateful to both of them. And they've been reliable suppliers throughout this event. So our emergency preparedness grant, we normally have a grant to run an emergency preparedness network. Through that, we have a handout that we put out every year. And this year it was going to be a guide for individuals and families who depend on service animals. We also have an in-person tabletop exercise that we canceled. And as you can see, we replaced that with 2 great webinars specifically directed at COVID-19 activities. So we added 2 more guides, a guide for individuals during the pandemic and a guide for home care workers during the pandemic. And so all of this information is available. I'll share that with you in a minute where you can find that and you can download it. Because we were unable to have in-person events, we decided to mail our new materials out to our emergency preparedness subscribers. And we took that second grant and we created 15 educational webinars specific to COVID-19. Now, some of these webinars have also been already taken place, and they are available, recorded and available on our website. Between November and December of this year, we will have additional events. That information will be put out. Those will also be recorded and put up on the website for people to view and to share with their employees. And then we submitted our normal grant application for the 2020-2021 grant session. And so we're just hoping that we get that so we can continue our good work. I want to thank everybody again for attending today, and thank again to the collaborative for having us. We're very proud to be part of the collaborative. If anybody is interested, you can go to this website, mdemergencyprepnetwork.org. All of the information on there is free, it's downloadable, and it's there for you to share with all of your direct care workers, your patients, and we urge you to take advantage of this. And if anybody's interested in learning more about Minka, there's our website as well. So thank you very much again, and I look forward to the rest of the presentation today.
Thanks so much, Dawn. Interesting, I think your comments about PPE, about training, really demonstrate the ways in which everyone has had to be exceptionally hardworking and really creative and really changing constantly throughout this as we learn more and as the whole situation evolves. And as Joe said, we're not done yet. Our next speaker will be Toni Moore-Duggan. She's an educator and adult primary care nurse practitioner, having graduated from the University of Maryland School of Nursing. She also holds a master's in organizational development from Johns Hopkins. She's an educator with the Caroline Center and serves as the program coordinator for their CNA-GNA training program, which involves inner city women in learning the art and science of delivering compassionate care. Toni, welcome.
Thank you. Thank you very much. Can you hear me? Can you hear me okay?
Yes, we can. Thank you.
Okay, great. All right. Good morning. Thank you for this opportunity. It's a privilege. Like all nursing assistants, as well as DNA instruction since the inception of the coronavirus restrictions, methods for delivering education in healthcare have changed. The serious transmission of the coronavirus has wreaked havoc on our lives. Restrictions of social distancing, use of PPE, and our lack of knowledge of this highly infectious, often asymptomatic virus continually redefines how we live our lives. We are intensely focused on saving our lives as well as the lives of others we serve. Heroes are coming out of the woodwork. Unfortunately, opportunities of clinical on-site learning experience in nursing homes and other healthcare facilities is less available at this time. The transmission of the virus of virtual instructions for certified nursing assistants and geriatric theory and delivery of skills training has become more creative, deliberate, and intentional. The use of Zoom, Google Doc, Microsoft Teams, and other virtual tools have skyrocketed beyond anticipation. While the fact that the mediums, the platforms of social media and virtual communication are available to a high degree, most of the students of Caroline Center are of a less affluent segment of the population and are impacted by the digital divide that affects Baltimore. They have neither computer hardware or available virtual services. To speak to this demand, Caroline Center quickly shifted into gear, made a student-by-student assessment to devise ways to meet the needs of each student and ensure the completion of their studies. The needs of food, housing, and safety were assessed and quickly addressed. Our community of social workers, advisors, and staff really revved up our goal and our mission to make sure that everyone was safe. When able, our partners at social services responded quickly to help us address the problems. During the onset of the physical restrictions of the virus, with their assistance, we were able to equip each student with a Chromebook and a $20 credit for internet service and data use. Unfortunately, those resources were not sustainable or available to our present cohort. But again, our developmental office is vigilant and continually looks for opportunities for assistance to our students within and outside of our Carolina Center community. Board members, staff, members of the community donated equipment for computers and virtual access and other needs as they presented. The School Sisters of Notre Dame founded the Caroline Center more than 20 years ago. Their charism of caring, compassion, and support in education embodied our role of delivery of healthcare services education at the Caroline Center. We speak to our women, we reach out to offer women who are marginalized, financially challenged, or underserved, and we give them an opportunity to advance their life circumstance through education and healthcare delivery. Our mission is to improve their self-reliance through value-based education as clinical and geriatric nursing assistants. We empower women to reach the fullness of their potential so that they can create a future of hope for themselves and their families. We deliver a holistic approach to education and healthcare delivery over 15 weeks. During the time, we stress values of integrity, respect, compassion, environmental awareness, community, as well as responsibility. Caroline Center consistently scores well above the national benchmarks for successful workplace development. We have received many accolades from employers and those who want our ladies to come work with them. Over 15 weeks, the CNA candidates are supported by a wide instruction of CNA theory, clinical skills, math, anatomy and physiology, essential skills of professionalism, emotional intelligence, computer literacy, resource writing, resume writing, communication, interviewing skills, conflict management, on and on. Daily access to advisory, counseling, social work, case management are mainstays of the Caroline Center mission. Career advancement is taken very seriously and are part of our mission as well. We deliver these services and we stress that Caroline Center graduates are members of the Caroline Center forever. Our commitment during the pandemic is to continue our work and ensure access to resources and completion of their certification. We are attentive and innovative and unwavering. As the pandemic hit our last cohort, 3/4 into their training, we quickly advanced the virtual program of Zoom, theory, skills training, and testing with careful attention to the standards of the Maryland Board of Nursing and the Maryland Higher Education Commission. We graduated 14 nursing assistants to the field of nursing care delivery in May. We had a drive-by graduation ceremony equipped with balloons, cheers, enthusiasm, masks, PPE, and social distancing. The cohort we started this July, we accepted 14 students. We assured their hardware and virtual access and supplied each student with learning materials of whiteboards, dry erasers, index cards, textbooks, Zoom training, and virtual training. We supplied blood pressure cuffs, stethoscopes, bedpans, masks, dentures, gowns, gloves, alcohol sponges to each student as we approach the skill set. Particularly during COVID, our social worker, advisor, and counselor continue to advocate for our students access to critical resources, again, of food, funds, safety, housing, and transportation. We continue to work at expungement services for our partners, with our partners at the Maryland Volunteer Lawyers and Public Justice Center to give our students every opportunity for successful, thriving lives. In CNA theory, we stress the bedrock of healthcare delivery is caring and compassion. We continually reinforce communication and presence as healing tools in the lives of those we are called to serve. We stress professionalism in all aspects of service delivery, when interacting with residents, members of the healthcare team, family members, and visitors. Even during the isolation period, students were asking if they were far enough along in their training so that they could help in hospitals and nursing homes. Following the guidelines of the CDC, the coronavirus allowed us to put a very comprehensive infectious disease control program in place. Caroline Center instituted virtual alerts throughout the building. We had a comprehensive infectious disease program to safeguard our staff, students, and visitors. Frequent building disinfectant occurs on a scheduled basis, as well as procedures for cleaning and disinfecting after any occupancy. A virtual screening tool to assess recent contacts, signs, and symptoms of disease are mandatory before getting access into the Caroline Center. Temperature taking before leaving home and before you enter the building is mandatory. Virtual signing in and out allow us to control and monitor occupancy. Mandatory social distancing as well as demarcated throughout the building, as well as well-placed PPE, signage, and social distancing markings, traffic patterns, and disinfecting stations are placed throughout the center. Resource list for coronavirus testing is also available. We follow the coronavirus guidelines of the city with attention to space occupancy and working from home. We have carefully advanced our on-site activities, such as onboarding when you're accepted into the program, limited in-person written testing seating, limited skills training and testing, while most instruction and testing continues to be virtual. We use the virtual tools, of course, of Zooming, Google Doc, and Word for sharing documents with staff and students. One of the most innovative things we have put into place are our clinical scenarios. There are 90 clinical competencies that the CNA candidate is required to demonstrate in clinical setting prior to completing the program. We have instituted clinical scenarios and role-playing that innovate the various competencies, theory, and skills class. The competency scenarios are in the form of case studies and videos and are followed by role plays. Critical thinking and discussion questions and feedback address skills, performance, and specific skills. We recognize the importance of weaving coronavirus education, self-care, updates, safety instructions throughout the curriculum. Much information is continually given to the students. While we stress organization, time management, flexibility, and adaptivity are important roles in entering the workforce through healthcare, the importance of self-care, safety, wage and benefits, self-dignity are paramount. If you want more information about the Caroline Center, carolinecenter.org. Thank you very much.
Thank you, Tony. And I was interested that one of your early comments was heroes are coming out of the woodwork.
Oh, yeah.
The truth of the matter is they've been there, right? And
Yeah.
maybe just starting to call a little attention to the folks who have been on the front lines for so long, right? Also, it sounds that Caroline Center is addressing very seriously the digital divide and the need, particularly in the time of pandemic, to make sure that a wider range of people have access to technology.
Yes.
Very important. Marla Lahat will be our next speaker. Marla is the Executive Director of Home Care Partners. She has a master's degree in social work from Temple University and is a licensed clinical social worker and certified as a mental health instructor. Under her leadership, Home Care Partners received honorable mention in the Washington Post for excellence in nonprofit management. Welcome, Marla.
Thank you very much. I am delighted to be here. Can everybody hear me? I hope. I am really delighted to be here and I am honored to be part of such an esteemed panel. I am going to share my screen. Okay. So just a little bit about Home Care Partners. We are a nonprofit home care agency. We're located in DC, but we do provide services in Maryland, in Montgomery and Prince George's County, as well as Arlington County. We've been around since 1957, and our clients are primarily low-income seniors and adults with disabilities. We have additional programs besides our home care program that supports unpaid family caregivers and also provides home modifications. We have about 150 home health aides and CNAs and approximately 30 additional staff. So during COVID, I think I'm not going to say anything that you haven't already heard or don't already know, but the challenges were immense, and particularly at the beginning. As was stated, March and April were horrific. The very first challenge was, how do we protect our workers and our clients? We stayed open. Other organizations shut down. We stayed open with very little guidance and almost no PPE. And it was extremely difficult to obtain adequate PPE at that time, and extremely expensive in addition. We also needed to create some educational materials about COVID and make sure that our staff and our clients as well were educated. We needed to deal with transportation issues. Not quite as much in our Maryland suburbs because many of our aides do have cars, but for anybody taking public transportation, in the DC metro area, public transportation was severely curtailed, and that created new challenges. And we also had to figure out, how do we notify contacts if an aide or a client tested positive. In addition, we had to figure out, do we keep the office open? How do we keep it open? What will make it safe for us to keep it open? And we were able to convert all our staff to teleworking, but we did keep the office open as well. We had to provide continuing education. You've heard about the educational challenges when you're no longer able to bring people into your setting in groups. And we needed to maintain hours of work for those who were still working. Most of our aides were still working, but a number of our clients voluntarily chose to suspend their service. So what did we do? For PPE, I felt like that was all I was doing for about 24 hours a day during those first months. I contacted everybody I could. I contacted Dawn at Minka. I contacted Leading Age. I contacted every professional association, colleague, local government agency possible. We had to get creative. There were distilleries that repurposed their operations in order to produce hand sanitizer, and we took advantage of that. We also found volunteer organizations. Volunteer mask making organizations were exceedingly helpful. We received, I think, about 1,000 cloth masks, and they are still coming in, that we were able to distribute not just to our aides, but we gave a supply to our aides to give to their clients and their family members as well. Education. We quickly ramped up and prepared some COVID education for our staff, and we updated it a lot because we had to. We prepared COVID policies and we updated those a lot. They are obviously only a few months old at this point, but I know our COVID policy was updated at least 6 times. We had to make decisions about who would notify the health department, funders, clients, family caregivers, and senior buildings if somebody was infected. And we've been very, very fortunate, very lucky, I believe. We've had a very, very low incidence rate. But still, we have had a handful of our aides who have tested positive. And what we found is that the senior buildings where these aides worked, if they worked in a building with a number of clients, were very, very concerned. So I took that responsibility upon myself to call those buildings, to call the management, so that they would know that we were doing everything possible, and we took it very, very seriously. We took our continuing education, and as you've just heard, we converted it. We could no longer do it in the office, so we developed mailing packets, we developed some online training, and we also recognized that many of our aides would not be able to do the online training without assistance. And so we set up a couple of computers in our conference room, socially distanced, and we set up appointments for our aides who needed help to come to the office where we could assist them. We kept our office open, as I mentioned, with limited staff, a lot of protective measures in place, and we invited our aides to come in when they needed to pick up PPE, when they needed assistance. They're out there working, and we felt it was important that we be here to support them as well. So although we have limited staff, we always have enough staff to work with our aides if they need some assistance. And we set a designated place for them to come to within the office. We looked at the schedules for our aides as well, because we found that with transportation being limited, we really needed to adjust some of those schedules so that either aides who drove could get to people for whom public transportation was no longer accessible, or where we could just adjust the timing so that the public transportation could be more available. We had one situation where an aide went to a client 3 times a week in the morning at 7:30 to help this person get ready for dialysis. The van picked them up at 10 o'clock. They could no longer get there at 7:30, but this client still needed somebody to help them get ready. And so the aide said she could get there at 8:30. And what we wound up doing, this was not the norm, but we had to make adjustments. We gave that aide adjusted pay to make up for the hour that she missed. We looked at Lyft, we looked at Uber, we looked at regional programs. DC had a wonderful and still has a wonderful program, the Taxi to Ride program. And this eventually, through advocacy, was expanded to home care workers as well, so they could get free taxi rides to their clients' homes if necessary. So what are our key takeaways? I think you've heard this as well. Communicate, 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 communicate as often as possible and as openly as possible. Admit that you don't know everything, or that not everything works. And we had to backtrack a number of times as new information became available. We tried to be as flexible as we could, and we tried to be willing to change things as needed. And most importantly, and I want to leave you with this, we did everything we could to support and acknowledge our direct care workers. Yes, they are the heroes. They are the ones out there. They have been putting their lives at risk, and because of them, our clients have continued to receive very much needed services. So we acknowledge them in any way we could. And some of it is very small, but it makes a difference. When the aides came to pick up PPE from our office, we had prepackaged snacks available, packages of cookies or chips. We even had a Girl Scout troop that donated boxes of Girl Scout cookies, and we were delighted to be able to give those away. We've had box lunches available for the aides. We did receive some funding, and we were able to give out gift cards, and that made a big difference. Just a simple thank you makes a difference as well. And we tried to say thank you, and we still try to say thank you as often as possible. And again, the extra masks, 1,000 or so cloth masks, we don't need that many, but our aides needed more masks for their clients and even their own family members. And once it was available, it was wonderful to be able to say, yes, take what you need. So I, invite questions during the question and answer period. This is my contact information, and I am really delighted that I could be with you today.
Thank you so much, Marla. You have certainly highlighted the many settings in which older adults live and the ways in which folks going into homes, senior care settings, really are making a difference all throughout this pandemic. I think your emphasis on the issue of communication is really key too. Builds trust and certainly more opportunities to recognize and lift people up. Finally, we're pleased to hear and to welcome Michelle Krause, who's the Executive Director of Ingleside at King Farm. She holds a Master of Health Services Administration from the George Washington University and was appointed by the governor to the Maryland State Board of Examiners for Nursing Home Administrators. Very important position. So Michelle, welcome.
Thank you, everyone. I'm so delighted to be here today. I want to thank the collaboration and my panelists and everyone on the call today. So let me see if I can share my screen, because I have 3 screens here. Let's see if this works. Okay, can you see this?
Yes.
Wonderful. Thank you. Okay, so good morning, everyone. My name is Michelle Krause. I'm the Executive Director at Ingleside at King Farm. I'm looking forward to sharing with you today what it's like to be a direct care employee with 300 staff members coming to work every day in the middle of COVID. First, I'd like to start off with a quote. I found this quote really meaningful. Your work is going to fill a large part of your life, and the only way to be truly satisfied is to do what you believe is great work. And the only way to do great work is to love what you do. If you haven't found it yet, keep looking and do not settle. As with all matters of the heart, you'll know when you find it. And that's from Steve Jobs. I am a firm believer that myself and my team, we found it. We're in this business to take care of seniors every day. So a little bit about my organization. It's Westminster Ingleside Presbyterian Retirement Communities Incorporated, otherwise known as Ingleside. We are comprised of 7 distinct entities. There are 3 CCRC communities. We have a home care service entity. We have a benevolent foundation and a construction company, and of course the management. There are 17 board members that comprise all 7 entities, and actually Dr. Leahy is one of our board members. Where I am in the field, Ingleside at King Farm is located in Rockville, Maryland, in Montgomery County. We have 365 independent living apartments, 64 assisted living apartments, and 45 skilled nursing beds. So a little bit about what happened to us. The last week of February, we were made aware of a positive COVID case in Montgomery County, Maryland. At that point, Ingleside collectively went into a state of emergency. We initiated our Code Purple emergency operations plans, and we created daily task forces. We met daily, including the weekends and evenings, and oh gosh, I remember speaking to attorneys on Saturday evenings, way into 11 o'clock at night, trying to figure out what we were gonna do next. We started with the C-suite leadership team, and then every day the operations team met, our 3 executive directors and our COO, and then I implemented one here with our 36 campus leaders. We partnered with our state associations for support and guidance, and I have over 500 residents today at Ingleside at King Farm and over 300 staff members. So how did we ensure that we were going to keep all these 300 staff members coming to work? There was no playbook. There was no Bible. There was no one helping us. At that time, local jurisdictions really didn't know what to do, and CMS did not initiate their guidelines. So the first thing that we did was we went into lockdown. We closed all of our engaged living programs, our dining venues, the pool, our art studios, our cultural arts center, the classrooms, our lounges, the fitness center, the adult day program, fitness studios, and we have so many entrances on the campus. We are well over 1 million square feet of indoor campus, and then we only allowed 2 main entrances where we could screen individuals coming in and out. And at that point, when this started, it was only our residents and our staff members. So as I mentioned earlier, we took immediate guidance from the CDC and the World Health Organization. We created electronic screening questions to ask folks as they came in, which was myself, my team, and residents every day, and still we're doing this. We take temperatures. We hired many security personnel in our garages and all throughout the campus to protect our most vulnerable population and safeguard our staff. We were extremely proactive in developing conservative protocols well before CMS shared any guidance with us. People are scared. They're still scared. We're seeing the spike slowly in Montgomery County. So what did we do to incentivize and retain our staff? The first thing that we did was we put into policy a COVID pay policy. So if any staff member was diagnosed positive with COVID, they were not required to use any of their PTO, vacation, or sick time. They received special exemption pay from Ingleside. And at the very beginning, there wasn't that 90-day rule where we really shouldn't test people that were once positive. So they received 14 days, and then we added an additional 14 days, so up to 28 days of exception pay if any employee tested more than once positive for the COVID virus. We implemented a 100% club incentive program, which went so well, and we really needed this program for our 2 assisted living neighborhoods and our skilled nursing unit. So those folks that were eligible were registered nurses, LPNs, GNAs, and CMAs. And the criteria for this bonus was that you must work all scheduled shifts. So if you had a vacation planned and you were only working 5 days out of the 14, you still received the bonus pay. You did not get paid if you called out, but this bonus program remains in effect throughout the entire pandemic and until it's lifted. What else did we do? We were so fortunate at Ingleside that we always had PPE available. We always had surgical masks. To date, our organization has spent over $620,000 on surgical masks, on gloves, gowns, goggles, shoe coverings, the whole gamut. Since April 8th, all staff members of our community receive a clean surgical mask upon entrance. So you come in with a cloth mask, you sign into our kiosk, you immediately sanitize your hands, and you're handed a brand new clean surgical mask every single day. Because we did this for our entire group, that includes administration, housekeeping services, laundry services, dining services personnel, clinical services, life enrichment, administration, property management, everyone, rehab services, everyone felt safe. We're protecting our folks. We also implemented, and this is fairly new because we didn't know until about 6 weeks ago that our county was going completely virtual with schooling. We have a lot of young staff members here who have young children at home. And so we put into place the Homework Helpers Program. It's truly amazing. We have approximately 438 independent living, vibrant seniors who have volunteered to tutor the children at home. And so our staff are offered modified schedules to support their children, to be at home with them, and so that they can attend their classes virtually. And the residents are offering their expertise in subjects such as math or science, English, foreign languages, essay writings. We see new applications every day. We also implemented specific assistance to deal with COVID, and this is called our Employee Assistance Program. So we do have staff members that lost loved ones, their spouses, and their parents because of the COVID virus. These services are complimentary with Ingleside. There are so many staff members that are feeling guilty because they were infected with the virus. They're scared, they're ashamed, and we continue to have staff members that are testing positive. And they are just shocked because they're not certain how they contracted the virus. So this program specifically helps with their loss of their family, their friends, their loved ones, and residents. Thus far, out of the 500 residents, and thankfully, we only had one pass away from COVID. But and of the 500, we've had about 6 residents test positive, which is really good. We also implemented throughout COVID our Employee Scholarship Fund. There are so many folks that are going on to school. They want to become registered nurses. They want to become architects. They want to become professors. It doesn't matter what their field of choice is. So 6 employees during the pandemic received $1,000 each for continuing their education. And it's our residents that donate and contribute money to retain our staff. And just last month, in September, we had 12 more applications from employees, and we are seeing more and more every day. And last, which was just so meaningful, is that the residents were so grateful that when we were under stay-at-home orders or safer at home orders, that our employees were coming to work every day, that they raised over $35,000 to give each and every employee $100 in July just to thank them for the good work that they do. So how are we going to continue to celebrate as we continue on this journey? We celebrated high school and college graduations. We were able to stream. Everyone in their apartment has access to our channel a station where we can present Zoom meetings. We speak to them every day. We have Good Morning Ingleside, and we are celebrating with our residents. Our staff have received care packages from us. We have given out many, many department gift baskets with gift cards and fun stuff and good treats. We constantly send out gratitude letters, thank you notes from myself, from the main office of Ingleside to each other. So there's a lot of support and camaraderie. We have, every month we have food and dessert trucks. And as a matter of fact, next week we will have Famous Dave's come by for all our employees and for our residents. And so that's another extra treat. We do Spirit Weeks, and as a matter of fact, today is Disney Day. I'm not really dressed up because I was presenting, but boy, you should see all the costumes throughout the campus of our staff and our residents. Most importantly, it's about leadership walking the walk, collaborative decision-making, and making sure that we acknowledge and appreciate our staff every day. So here's just some of the good things that we've been doing. We come in on weekends, we give sweet treats to each and every staff member. We have had outdoor parades and sing-alongs. We created, and this is the employees, we created songs, lyrics to tie a green ribbon around your balcony. And when you walk throughout the campus, everybody had green ribbon. The residents were outside singing. You could hear it really through King Farm neighborhood. I create my own personalized poems to give to all of our employees with gifts. And this one they love the most. It says IKF Strong, which is Ingleside Strong, and it's the hand sanitizer. They attach it to their belts or to their purses. And it's refillable. So we know we have a long journey ahead. My crystal ball doesn't tell us how long this is going to last, but it's going to be a long time. But we're here every single day taking care of our seniors, which is what we do best. So thank you again.
Thank you so much, Michelle. And you've raised some I think really important points that we may want to have more discussion about. Things like childcare and virtual school and mental health issues, the kind of trauma that everyone's been through and still going through and getting awfully weary during this pandemic. Now's the time for us to do some questions and answers, some interaction. We've got close to 10 minutes. And I know we've gotten some comments in the chat feature. If you have other comments or questions, please put them in. What I'd like to do is ask the panelists to show yourselves, turn your video on, so that as we work through questions, you can kind of wave if you want to take that question or make a comment, okay? So the first question that came in was highlighting a leading age national study that has just been published that really makes the case that paying frontline workers a living wage is good economics across the board. It really returns benefit. The question was, so if that's the case, what are the barriers and what are the potential solutions in terms of advancing living wages? Anybody want to take that one on? Go on.
Thank you so much for that question. It's a very important one. My providers, we have this conversation all the time, especially for the Medicaid providers. The Medicaid reimbursement rate is set at, I think right now at $18 and change an hour. And that is not, so that $18 an hour is just what they get from Medicaid. Now, what the agencies have to pay with that is the payroll, actual payroll taxes. They have to pay their office employees. They have to take care of their office. And also one thing that I don't think people are aware of, in Maryland, the nursing services that are required by the state are not covered. So that also comes out of that money. And so the providers are extremely limited. They want to be able to provide additional reimbursement to their aides. They want to do extra things, provide them with benefits. But with that very low reimbursement rate and minimum wage continuing to rise, that gap continues to get smaller and smaller. and it becomes much more difficult for the agencies to stay open. I have a couple of agencies who are in peril of closing because of this, and we're working very hard with the Department of Health in Maryland to try to get them to see this, because there is not a provider, at least in my network, that doesn't want to give their aides more benefits.
All right, that's true. That's true of skilled nursing and rehab centers as well. I mean, the underfunding of Medicaid across the post-acute long-term care spectrum of care, from home health to nursing homes, and the fact that in the country we have only about a 15% Medicaid penetration rate in assisted living is problematic. And so it's gonna take all of us to appropriately fund Medicaid across the continuum of care, and focusing again on healthcare disparities so we can actually slow multiple comorbidities of older folks, when they're in their 40s and 50s. We wrote about something in March in a national op-ed when Jill and I were doing work together, actively searching out PPE. And that is, this might be the time that, in addition to the federal government providing CARES Act funding to providers and to states, to really take a look at an increased federal role in the appropriate funding of Medicaid, because there just aren't enough dollars. And, nursing homes, home health, assisted living, we all want to pay the maximum amount we can to our frontline heroes. But we work in a sector where we don't control about 80% of the revenue comes in. We take what the rates are, Medicare and Medicaid. So
well, certainly it sounds like, advocating for appropriate reimbursement is one huge step. That's for sure.
Absolutely.
Let's go on to another question, because we want to make sure we get across the board here. Each of you talked about challenges early on, getting PPE, needing to educate about infectious disease, lots of things. As the months have worn on, what are some of the current challenges, and what do you see as the coming challenges? I'm sure everybody has something to say about that, right? Marla.
Okay, thank you. Yeah, I think at the beginning we did face very distinct challenges that eased up somewhat. When I mentioned PPE, the surgical masks back in March or April, if you could even get them, were over $1 each. I just got a new supply for 18 cents each. So, a lot of that has certainly eased up. But as we continue, I do think all of our strategies have to remain in place, because number one, we may have a new surge, and we don't know that. We need to continue educating. We need to continue protecting our workers as we move forward. These are all challenges that haven't disappeared, and sometimes we get a little bit lax as we move forward with this. With more testing and more knowledge and more PPE out there, but we still have to be as vigilant as we possibly can.
Others, thoughts about current and future challenges?
I think from an educational standpoint, can you hear me?
Mm-hmm.
Yes.
Okay. From an educational standpoint, I think the learner themselves, the fact that the students are trying to learn is often impeded by the fact that for Zoom classes, for skills classes, they're often in, they have their family around them. They're trying to educate their kids on their own Zoom classes while taking their learning seriously. And that, particularly for our population, seems to be coming up a lot. You're often on a Zoom class where you're talking to a student, and suddenly the little one, they want their snack, or they just want to hold mom. And we have to be able to make allowances for that and help them with that. So their commitment, though, to their own learning objectives is always amazing to me. So
that's a really helpful point, Tony. Michelle.
Yeah, for our campus, as we found out yesterday, when the positivity rates increase, we're going to have to test twice a week. And it's already been so distressing on our staff and so taxing on them. They just, you know, they're sad about it. Every week you're getting tested. And I don't know if any of you have been tested before. I've been tested 5 times. I mean, it's uncomfortable. We don't know what the after effects are going to be. Every time you're doing the traditional, it's the PC, I can't think of the name of it.
PCR.
Yeah, PCR testing. Thank you. I'm so used to hearing rapid testing right now. So, but we don't know. And so I'm worried about the morale a little bit for the staff. Twice a week, how we're going to find the time to do that. And then again, with our residents as well, especially those in the health center.
And certainly another question that's come up is, and I think this may be a challenge both in the present and the future. What are you seeing in terms of turnover? And what do you see as the longer term effects of the kind of wearying pace, and Michelle, as you said, the testing, but really, in fact, the continued danger, the sort of exhaustion that people are having trying to attend kids in virtual school. What are you seeing in terms of staff retention and turnover? Marla.
Speak to that. I don't know that we've seen an increase in turnover because of the pandemic. We had a group that went out at the beginning due to COVID-related concerns, maybe childcare, et cetera, that have not been able to return. But for our other staff, they have remained with us. But this is a high turnover field. It always has been, and it probably always will be. And so I was really very excited to hear what Tony had to say about the education that's going on, because we need a constant supply of new CNAs, new home health aides that can come into the field and that are willing to come into the field during a time when it is more challenging than, it's more challenging than working in a grocery store. And we all know the challenges of working in a grocery store right now. But if, and I'll give you an example, in DC right now, the living wage and the minimum wage are both $15 an hour. They're identical. Why would you want to put yourself at this level of risk and this level of daily challenge when you can go and work in Target, let's say? It's very, very difficult. So we need to constantly be recruiting, and that's been certainly hampered by the pandemic as well.
Thanks to all of you. We are out of time. It is time for us to turn our portion of the program back over to Dr. Leahy. Panelists, thank you so much. Thanks to participants. I'm assuming that if you continue to have questions or want to make comments, you can do that in the chat feature. Make sure that you're doing it to all panelists and attendees. And I think we'll keep right on moving. Thank you all.
Jill, thank you very much. Thank you. And thank you to all the panelists, each of whom has brought a different perspective and has given us, I think, collectively, a great deal of information as to how they have been working through times of immense stress and change in their adaptations, all of which I think will prepare us into the future, and certainly all which will be helpful for our third webinar coming up on the 22nd of October. But again, thank you all for all that you've been doing, both for your workers and for the community at large. We're going to have concluding remarks today from another very experienced and dedicated individual, and that is Amy York. I had the pleasure of meeting Amy when she began as one of the founding board members of the Maryland Regional Direct Services Collaborative. Amy currently serves as the executive director of the Elder Care Workforce Alliance. She's had previous experience working for the Jewish Federation of Metropolitan Chicago, and has had longstanding and has been a longstanding advocate for seniors on issues of Medicaid, Medicare, and caregiving. So Amy, we're going to turn it over to you for your concluding remarks, and thank you for joining us.
Thank you, Bill, and thank you everyone, all of our panelists. I think that We've had a really informative day today, discussion today. It's, you know, you've all laid out the critical role that this workforce plays. And as many of you said, you know, COVID has really shined a light on this workforce that we've known is so important for years. So we're, thank you for doing that. Before I jump too far into this, I did want to highlight a couple of documents that have come out recently that particularly relate to this workforce. As was already mentioned, Leading Age has a new report about the pay, and that is, I'm just going to share my screen here and show you the report. Nope, that's not right. Okay, yes. So this is the pay, this is the report that we were talking about, and within the chat, I included a link to this report. In addition, every year, the PHI comes out with a report on direct care workers and key facts, and there's state-by-state information in there as well. I think that's really important as we're looking at advocating for this workforce. In addition, specific to the coronavirus, as part of the CARES Act, a commission was created. And just in the last week, that report came out. And specifically, I'm just going to scroll down here to the recommendations. There are several recommendations around workforce. You can see here the workforce ecosystem had several different recommendations. And then also one in particular that I think EWA will probably take a leadership role in is the establishment of a separate commission on workforce in dealing with many of these issues moving forward. And then finally, there's the long-term services and support state scorecard, which is put out by all these different organizations. Every year it's updated. And Maryland is actually in this top tier of states in this scorecard. So take a look at it. I think they're listed as number 13. And it's, you know, it's really about what are the services that are available. And even though we may feel like Maryland is lacking, we're actually doing better than a lot of other states. So, so we, and not that we can't be doing better, because I think we can be doing better in terms of these services. So so I wanted to take a few minutes to kind of wrap up our discussion in terms of kind of what was said today. And I think I think what I heard was that most of us have always been somewhat troubleshooters in terms of ensuring that the care provided to older adults and those with disabilities is good quality care. But with COVID, it has just, you know, quadrupled in the work that we do. We're constantly troubleshooting and trying to figure out what to do in terms of next steps. And a lot of that had to do with the fact that, you know, things changed so quickly. But also it also had a lot to do with the fact that this workforce is already overtaxed and already faces a lot of challenges as we move forward. And you all have shown such creative ways of putting together trainings that you probably have never thought about in ways that you've never thought about by using technology and teaching others how to use technology, especially your workforce. I think technology, all of us have learned a lot more about technology in the last several months. I know that I never really use Zoom in a way that I do now, and constantly do. And I know that that is something that that has been a challenge that you've had to overcome and have overcome in terms of training your workforce on these different technologies. I think one of the things, Tony, that you brought up that I hadn't thought about is that not only does your workforce need PPE when they're caring for older adults, but they need to have cuffs and in terms of when they're being trained in how to use different technologies and different instruments that they would use in their everyday work. Getting those supplies out to people is just something that is something that you just have to think through, that you wouldn't have had to think through if they were in a classroom setting. So those are the troubleshooting things that I think that have shown how creative really you all have been. The whole homework support piece, I think, is just great that you set up in your Ingleside facility as well. I think that is really a great opportunity for you to share the expertise of your residents, and they probably feel fulfilled by doing that as well. So I think that's also another great way to kind of think creatively and outside the box. Also just the appreciation that you share for your workforce, which I think goes on constantly, but is especially important during this time, and the support that's given, as people they know are getting COVID. As someone who has personally dealt with this, it's a tremendous weight on the families, but also it's a tremendous, it's a really scary thing. And to have this workforce out there constantly in the midst of this, I know is a scary thing, but also so important that we are supportive of and reassuring to this workforce as we move forward. I think that as we look forward, it's really important that we continue to shine the light on this workforce. I think that there are going to be opportunities to really address some of the issues and perhaps perhaps changes in the Medicaid program. I think there are certainly opportunities to address training. I think there will be additional pushes to get home and community-based care in place that is much more robust, and that there will be more support for that. I think there also will be opportunities to ensure that this workforce in long-term care settings also gets the attention that it deserves. I think those are all opportunities at both the federal and state level that we will see in the coming year. And I look forward to working with everyone and ensuring that we take advantage of those opportunities as we move forward to really highlight this workforce and ensure that that they are adequately represented. And thank you all for joining us. And I guess I'll turn it over to Bill for some closing remarks.
Amy, thanks very much.
Mhm.
And once again, I want to thank everyone participating today and those in the audience. What we've heard today from Joe is that we're probably in the third inning of a 9-inning game or 11-inning game. This has been discussed by several other people. As we all know, the science and the politics involved have become difficult, and without consistent messaging and understanding, you as organizations and leaders have taken the ball and shown us all innovation, adaptation, and true leadership. And you should be congratulated for all this. I know it's been hours and days, and with all the conflicts involved, you have demonstrated today at a high level exactly what we need to do as a community and as a nation. But I won't get into the politics any further about this. I think we all realize also that the science has changed, and the learning of the virus, the effects of the virus, and the potentials have changed. We're all in the learning curve, and you're in the curve of adapting the workforce to this very unsafe environment. And you've just done wonders, and thank you all for all you've done and will continue to do. The third webinar, which will be on the 22nd of October, will kind of thrust us into the future. What have we learned through the last 7 or 8 months? What have we learned from today's wonderful panel discussion? And how can we incorporate some of these changes moving forward? How can we look at the policy level? How can we look at the individual organizational level and buttress the support for the direct care workers? So once again, I want to thank you all for spending the time today with us. Thank the audience for their questions, and please join us in a couple of weeks as we look into the future. Meanwhile, stay safe and stay well, and thank you all for your wonderful leadership. Take care.